last instructor certification date, then you have to restart the whole process from step 1. So all these things, right now RGUHS has uh, instructed us to put this instructor status on the website, and it will be visible for all the instructors inactive, discontinued. And if it is inactive or discontinued, please make sure that you come back and get trained as a step 2 or under the senior instructor and reactivate your status. It will be on a public platform now, and all of you will be able to see it. And post this till here I was speaking about the instructor course. Now coming to rollouts, that is ECLS rollouts. It is mainly for the interns and other healthcare providers, and the dates will be scheduled in mutual concurrence between the host institute as well as JeevaRaksha. So here we say that it is a 2-step process. First step is where the course director has to finalize the trainee list and request in ECLS, the maximum trainee list is 30, and they have to request for JeevaRaksha approval through mail. So this has to happen 2 weeks before the course date is scheduled. And the registration and certification fee of rupees 1,500 should be deposited to JeevaRaksha bank account. And post this, after we receive a mail, Team JeevaRaksha will reply back to you after verifying the trainee list, receipt of fees, and then send an email confirmation saying that you can conduct the course. So what do we teach in ECLS? I think all of you would be very familiar with this, including few nurses and other people who have joined, that in ECLS, we aim at revising the essential emergency care concepts, introduce emergency management protocol, and updating latest evidence in emergency management. And these are the theory sessions which are included in the ECLS module. So in ECLS, right now we have 3 types of courses, that is candidate driven, which is called hybrid module also, centrally supported, that is face-to-face, and locally managed face-to-face. Let us know what it actually means. So in a candidate driven course, learning during the actual theory classes, the classes are taken online, that is through a LMS module. The candidates will receive link and they have to complete the theory sessions online in a duration of 10 days. So after that, the candidates will be asked to come to the practical sessions, where practicals will always be hands-on. And in a centrally supported face-to-face course, it is a maximum of 30 candidates. I'm sorry, I just got to know that the PPT is not visible. I'll just come back.
You're visible.
Okay, thank you. So in the candidate driven or a centrally supported face-to-face model, so in this, it is a face-to-face interaction between the students as well as the instructor, and locally managed face-to-face is also a face-to-face interaction. But here what we have done is through the LMS module, the students will be completing the theory, and practical will again be face-to-face. So mentoring, as you all know, it's a process where a group of 10 or 5 candidates, depending on the number of instructors, will have mentors. So here in an online module, a group of 10 candidates will be supported by one mentor, and the mentor is supposed to meet the candidates face-to-face or through online at least 4 times, and it should be a duration of 60 minutes. In face-to-face, again, at least one mentor per 10 candidates, and they have to meet face-to-face or online and have discussions related to their doubts or whatever they need to discuss regarding the theory modules or the practical modules. So coming to practical module in ECLS, we focus on these 10 areas. So airway management agents, intubation, cardiac emergency scenarios, obstetric emergency, neonatal, choking, trauma, interventions as well as procedures, trauma and burns case scenario, and other case scenarios. So in the practical module, each station will be for 60 minutes, and the instructor has to assess in 2 steps. One is during the practical session per se stage of practical total examination score. So if the student, we are grading them out of 100, 20 marks will be from the practical skills, not the training, not the exams, but during the skills only. That is called concurrent assessment, where instructor will mark out of 20 how much the candidate is scoring, depending on their team leader skills and their enthusiasm and how they get involved in the practical skill station. They will assess the student. So in the practical exams, it will be again marked on the LMS score sheet. 80% of practical examination marks will be assessed during the exams, and 20%, as I already told you, during the concurrent assessment. And including both the marks, they have to score more than 70%. So JeevaRaksha always encourages monitoring of whatever programs or processes are happening in the institution as well as in JeevaRaksha. So during the courses, an observer is sent to the respective institution, where he observes speaks to the candidates and the instructors and grades the quality of the instructor, course as well as the training center. So these things will be logged in the LMS and will be used for critiquing quality improvement and accreditation process. This is one step where observer fills in the observer form and gives quality improvement strategies. As well as we have the feedback session, option for the candidates who will give feedbacks related on the module, instructors as well as mentors on the LMS only. So all these will be collated and respective instructor profile will be created, where we evaluate and have a database where instructor's status will be visible to instructor, course director as well as JeevaRaksha team. So whatever I spoke today, this is the whole flowchart of how ECLS is divided into 3 streams. That is LMS online driven, LMS plus classroom with central support, and LMS plus classroom and on-site mentoring. So this has to be completed in 10 days and followed by post test, that is after on the next working day. And after the candidate finishes the post test and passes with the marks of more than 70%, he'll be eligible to take the practical test. And after that, he'll be certified as a JeevaRaksha provider. So how we evaluate, as I already mentioned, so theory exams and practicals, both of which they have to pass with more than 70%. And after that, they will be given a provider certificate by RGUHS through JeevaRaksha Trust, and the certificate looks like this. So till now we spoke about ECLS courses, and to just brief you about ENLS courses, that is emergency nursing and life support. It is almost similar to how we conduct the ECLS courses with few alterations, and I'll be highlighting only about the changes. So here again, it is scheduled with mutual concurrence between the host institution as well as JeevaRaksha. 2 weeks prior, you have to send a finalized trainee list for JeevaRaksha approval, as well as the candidate fee of ₹900 here. ECLS was 1,500, ENLS is 900 per candidate. And after verifying the trainee list and the fee transfer, JeevaRaksha will give approval for conducting the courses. So in ENLS, we aim at revising essential emergency care concept, introducing emergency nursing triage and protocols, updating on latest evidence in emergency medicine. So here, the new topics compared to ECLS are emergency triaging, emergency psychiatry, communication and teamwork, and safe transport, which is for the ECLS course. And learning, mentoring, theory module, modular tests, final theory exams, all are similar to ECLS, so I'm not going to explain it in detail. Coming to practical module, after the candidate passes the theory examination, he'll be eligible for practical module. And in practical module, we have highlighted 4 things, that is triad, psychiatry emergencies, communication and safe transport. Here, these things will be dealt with separately in ENLS courses. So the 9 competencies are taught and tested using 2 types of practical sessions, that is procedure and clinical intervention using the skill stations like ECLS only. But there's a new concept called impact stations in ECLS, where the candidates are given scenario-based examples, and they have to imbibe, mediate, prepare, act, communicate, and transfer the information accurately. Only then they are considered that they have understood the concept and they are eligible for certification. So in the impact station, what happens is we allow the candidate to practice and demonstrate skills like communication, triage, managing psychiatric emergencies, and preparing them for safe transport. And this is a team activity rather than an individual activity. And the instructor will give a case scenario with basic information. But then the candidate has to imbibe that information, mediate it to the team members, that is assigning roles to them, saying that you are the ambulance driver, or you're the group D or a helper for shifting the patient, and you're a nurse, you're a doctor. Like that, they have to mediate and assign roles for the team members. Then prepare the response, like getting the equipments ready and talking to them about the procedures, explaining to them the procedures and protocols, and act appropriately, taking the leadership role. And all these will again lead to a better communication among them, and how they transfer the patient to a safe environment is assessed in this station. So a practical examination is almost similar, but the only difference is every day afternoon session will be exam stations in ENLS, unlike ECLS, where only last one day is the exam station. So here again, the evaluation and practical skills are assessed through LMS practical score sheet, and the candidates have to score a percentage of 70, including both concurrent assessment and final practical assessment. And who do not achieve 70% will have to redo the impact station scenarios on day 3. So how do we monitor ENLS again? Observers will be sent to the institutions to observe how the quality of course is, and the quality of instructors and the training center. And this will be logged in LMS. And this is very similar to ECLS, as I explained before. So observer role as well as feedback from the candidates. Everything will be collated, and the instructor and the training institute will be scored. And this is also similar to ECLS, so I'll not be explaining in detail. Again, same. So once all these criteria are fulfilled and the candidate finishes the 3-day ENLS course, completing it with more than 70% pass mark, he will be provided with ENLS provider certificate, again by RGUHS through JeevaRaksha, and valid for 5 years. Coming to our BCLS course. So BCLS, as you all know, is basic care and life support. It's a 1-day course, and here the maximum number is 40 per course, and the fee structure is 150 rupees certification and registration fee of 150 for RGUHS affiliated, and 300 for non-RGUHS affiliated people. And again, the trainer list should be sent, and it will be verified by JeevaRaksha, and email approval will be given. So here the theory modules aim at understanding essential emergency care concepts, introducing hemorrhage control, cardiac arrest, and defibrillator protocols, and update on management of common emergencies. So these are the 9 different topics which are covered in BCLS courses. Again, candidate-driven model as well as face-to-face model. In the candidate-driven model, the candidates will be sent links through online LMS, and they have to finish the theory module online in a specified 5-day period. And they can do it whenever they can during their convenience, but finish it within 5 days before coming to the course. So mentoring, again, one mentor per 10 candidates, and will at least meet 3 times, face to face or online, and the session should be for a duration of 60 minutes. So in locally managed, that is face to face interaction, a batch of 40 people are brought together into one classroom, and certified JeevaRaksha instructors will run the session through LMS module on screen, and the module should be completed within 2 working days. Mentoring is again the same. And theory evaluation, after every theory module, they will have module tests where they have to take a group of 5 or 6 questions and pass the test. And post that, after they've finished all the modular tests, they will be opened up to the theory exams. And after finishing the theory exam, they have to again take the practical module. So in BCLS, we focus on cardiac compression technique with emergency scenario stations, choking, and tourniquet techniques. And practical evaluation is again in the afternoon session over 2 hours, and evaluation will be again done through LMS practical score sheet, and the candidates have to score more than 70%, including concurrent assessment and final practical examination. Monitoring, again, observer level monitoring as well as feedback from the candidates. So this is the overall flowchart of BCLS, LMS plus online mentoring, LMS at classroom plus online mentoring. So this remains the same. Again, they have to pass theory as well as practical exam with more than 70%. And post that, they will be given BCLS provider certificate, which is again valid for 5 years. So one thing which probably has got missed out here is, probably while I was telling about this certification fee, I was only mentioning to all of you regarding the registration and certification fee. The overall fee is different, like ECLS is 5,000, ENLS is 3,000, and BCLS is 1,000 per candidate. So with this, I think I've come to the end of my session. So question answers will be taken at the end after Dr. Sriram Kora finishes his presentation. So next presentation will be by Dr. Sriram A. Kora. He is the professor, HOD of Department of Medicine, director in charge of biomedical department, and he also manages a skills lab in S. Nijlingappa Medical College, Bagalkot. So his session is about setting up an accredited skills and simulation center in an institute. Thank you.
First of all, I'm audible.
Yes,
Yes,
sir.
sir, you're audible.
ಹೌದ್ರಿ ಕೇಳಸಕತ್ತದ ಚಲೋ.
You're audible. Yes, sir, you're audible.
Can you hear me?
Yes, sir. Dr. Kora, you're clear and loud and clear. We can't see you, but you're very audible. Thank you.
Yeah.
Yes, sir, we can hear you clearly.
Yeah, sir. first of all, thank you, Dr. Vijay Bhaskar sir and Ram sir, for giving me an opportunity in giving a talk on setting up of an accredited skill lab and simulation center. Okay, coming to the first, let me clear skill lab. Here, I am not only concentrating only skill lab of for the JeevaRaksha sake, and even we are all the medical colleges, we should have a skill lab as far as is mandatory from NMC and Rajiv Gandhi University. So I will be dealing with all the types. So let me tell first what is the skill lab. It is a safe place for the student to learn, practice, and be observed performing the skills in a simulated environment without risk of direct exposure. So that is very important. So there are some life-saving skills and other things which we will be not able to teach in our general setup. Then coming to the skill lab, there are 3 types of skill labs: level 1, level 2, level 3. So the level 1 involves the basic surgical skills, basic life support skills, procedural skills, normal labor management, and conduct of delivery. So this level 1 is more than enough for NMC. And even for adding something extra here, even we can set up the same thing which is required for our ECLS. Then coming to the level 2, so whatever is there in the level 1 will be there. With added to that, there will be advanced life support, basic laparoscopy skills, neonatal and pediatric resuscitation skills, which we are teaching in ECLS, which is added in the level 2 skill lab. Then what is level 3? Level 2 plus microsurgical skills, advanced lab skills, human patient simulator for anesthesia. Even you can add a phantom and ultrasonography, radiological, sim and sim mom. So it is never ending. Almost all the procedures you can able to make it. Then in crude language, what is skill lab? Skill lab is nothing like simulation centers. No, but this one, it is a hospital of mannequins. So what we are having the hospital for the patient, same it is for like hospital of mannequins. They're like what hospital we are having. There will be OPD, IPD, ICU, OT, casualty, labor, and the same setup we can have it in the skill lab so that it will be easy. So what all we can do? We can learn, we can teach, we can observe, we can assess. So these 4 areas, learning, teaching, observing, and assessing is very important in all the skills what I have mentioned, like life-saving skills, OPD examination, IM, IV, SC, subcutaneous injection, tapping, CPR, ventilator. So almost all the skills we are able to teach in the skill lab. So the area, so for the 150 students, 6,000 square meter is the area required for establishing skill lab. For 200 to 250 undergraduate intake, it is 800 square meters. Means if you convert it into square feet, it will be roughly 8,000, and 600 square meter is around 6,000 square foot. And the same for JeevaRaksha, which they have made mandated and as per the rules in 2019, where it says that 300 square meters is required, 200 for the hall and 100 for the lecture. So coming to the infrastructure, there should be a lecture hall with AV equipment, with internet, with e-learning projectors. So one hall is there where we have to teach with all the audiovisual equipments and the e-learning internet. Then equipment for video recording and feedback is must. Then coming to the infrastructure for 100 students intake, that is roughly. So they want to divide that 15 to 20 student as a batch. So that is what they have made. Same thing can be applied here for ECLS also. Exam rooms 8, 4 is a must, 4 for optional. Debriefing room, demo room, storage space, coordinator room, and support staff room. So that is about the infrastructure. Then coming to the mannequins, for 100 students, NMC has given adult CPR 5, pediatric 5, neonatal CPR 5. These are all mechanical where you can teach airway management and CPR. Various injection modules, catheter, skin suturing, breast examination 2, pelvic examination trainer and a delivery trainer, they have made it 4. So these are the basic, which is the must mannequins as per the NMC. And then low and high fidelity, they have given for methods and procedures and assessment. Some mannequins, they are not mentioned. But if you want to have, it is better to have nursing mannequin, NA, QCPR, SIMMAN, sound trainer, BP arm, CPR meter, that is to assess your CPR quality, then ear examination, fundus examination. And he has mentioned in NMC also there is hybrid, so that is guide. So like in breast examination, one person will be wearing the breast examination module, so like that. And even in the trauma and where we can use the volunteers as the patient simulator, so that is also is there. So these are the 3 types. One is basic mechanical, then low or high fidelity, third one is hybrid. Then another one they have mentioned is CAL lab, computer aided learning lab. It is 10 students, 1 computer, 25 computer, basically pharmacology and physiology, animal experiments. So coming to the mannequins, so the NMC has given the mannequins, but the if you want to held as a JeevaRaksha training center, you should have additional things which is not mentioned in NMC, like AED, 6 number, adult airway and pediatric airway, ECG simulator. These are the things which is not there in NMC, you have to add it to have this one. So most of the places it will be medical college because they will be going as per the NMC. So these things you can add them. And ICD, intraosseous needle, cricothyroidotomy, these 3 types of mannequins. If you are having enough cadavers and if there is a cadaver session, then there is no need to have these modules, or you can have these mannequins. Then coming to the consumable and accessories for all the procedures for mannequins, already I told it is like a hospital of mannequin. So what all the accessories you are using in the hospital for the procedures, all the things there will be there. So it is already exhaustive list has been given by JeevaRaksha. So it will be laryngoscope with cell, ET tubes, bag and mask, nasal cannula, catheter, jelly, ICD, magils, dissection instrument, IVF, circuits. So like that, there will be so many things which is required, starting from the paper, pen. It is a very big list. We had a tough time when we started in 2015. Now we have almost evolved over 7 years to 8 years. So now everything is ready, but initially it will take a tough time. So better to have a list which is already circulated by JeevaRaksha. So you keep it with you. Then recently the NMC has introduced COVID skill lab, and even in the ECLS also in the some programs we wanted to have a COVID skill lab. So in the COVID skill lab, it is a must for the college and dedicated COVID hospital, DCSC, CCG, everything. So almost whatever is required for JeevaRaksha and NMC, it will be the same. But you have to add some equipments which are used, the same machines which are used in the hospital, like ventilator, HFNC, BiPAP, oxygen concentrated, oxygen cylinder, and oxygen pipelines. So to show some setup of pipeline valves and alarm panel. So my request is, whenever you want to start a skill lab, it should be in the hospital in some of the floor, it's okay, or it should be near the hospital so that you can extend the same hospital atmosphere for the skill lab, where that is simulation of the environment will become easy. So like in ICU, you can have an extension, same thing can be done. So in COVID skill lab, they wanted us to visit manifold, jumbo cylinder, dura cylinder, evaporator, liquid medical oxygen, and oxygen generation plant. So these are the some of the things which they wanted that in second wave of the COVID, what hit India very badly, that time the skilled persons were not there, and none of the interns and the PGs, doctors, and many people who are not involved in infrastructure development in the hospital, they don't know how to connect the cylinder, how to change the cylinder, what is mannequin, how to change over the liquid manic oxygen, alarm system, nothing. So it was a very tough time because those person is not there, or he is down with COVID, or he has gone somewhere. So it was a very tough time. So that is why NMC and everybody has mandated, starting from the oxygen generation to the end to the patient, all the instruments and all the things has to be taught to everybody. Then coming to the next, human resources. This is very important, most important and essential, but it is not given importance because most of the time management is only concerned about the infrastructure and funding, and after that nothing will be there. Coming to the human resources, one is full-time staff, that is master trainer, dedicated, young, enthusiastic, and these full-time staff is very important. I will come at the time of limitation. 2 to 3 or full-time staff is required. ENLS, BCLS, all certified trainers around 20 to 25. Even what we are doing is ECLS and BCLS trainers, nursing ENLS trainers, and support staff. Clerk cum computer operator is 1, mannequin technician 2 to 3, videographer 1, daily workers 3 to 4 to lift the mannequin and keep it in a safe and proper place to be there. And the trainers to be certified by JeevaRaksha, AHA, IAP, whatever the thing. Here we are using JeevaRaksha trainers for our ECLS program. Then coming to the budget. Budget is for the place, it is already available. Infrastructure, I'm not adding, civil, computer and furniture. Then coming to the mannequins. Mannequins around the mentioned the 150 the mannequins from a good company, it is around 80 lakhs to 1 crore. So the low fidelity, high fidelity, basic mannequins and other things. Only for JeevaRaksha, if you want to have all the mentioned what I told, around 20-25 lakhs rupees of worth mannequins are enough. But anyhow, if you want to have a level 2 skill lab, only your mannequin equipment will be around 80 to 1 crore. Is the maximum budget I given, but you can establish around 60 to 70 lakh rupees the good skill lab. Coming to the up till now, so these slides were there up till now was for the establishment. So after establishment, the real things will start. So what are the limitation for the establishment and going ahead with the skill labs? So this is what I have made. Lack of infrastructure facility. In some skill labs, there will be lack of infrastructure. So that is why we are planning is a must. Inadequate funding. So the management will not be able to fund it. So the thing is, one point, all the medical colleges in Karnataka, they in private medical colleges, they are charging 30,000 rupees per year per student. So it is 100 intake, means it will be 30 lakh rupees per student. So there will be 5 batch. So first year batch, second year batch, third year, fourth year, fifth year, look, fourth year. So 1.2 crore rupees of for 100 students, they will be getting the fee every year only for skill lab teaching and maintenance from the college to the college. So the same thing in government, it is 5,000 per student. So all the PGs and all the UGs are paying in Karnataka. So then I don't think there will be inadequate funding. So we have to fight for it. Lack of faculty, lack of adequate support staff, time constraint, and the staff which is posted here also posted there also. That is why it is come the time concern. Preoccupation with patient care. He is interested in only in patient care, not in skill lab. Resistance to change. When we started, we used to have senior faculty who doesn't want to change it. So the old protocols, old the style of living. So the thing is, and now Haripriya madam was telling and Vijay Bhaskar sir was telling, so over a span of 8 years from writing the form, now we have come to Google form now, and it has become this one. So we have to change with the time. Attitudinal problems, lack of incentives, that is what I told. There is nothing funding, so much of funding is there, so there should not be any problem. Lack of support from the top management, that is we have to go and ask them. Lack of experience in maintaining the things. New institute, so there will be trainers would be less. Irregular programs, interference with private practice, because they will be only interested in private practice. So these are the limitations which we have encountered, or any skill lab in the initial stages. These are the things they will have it. So how to improve on it? Suggestions. Then first you set with what are the programs you are going to do, what all the things are required. So you strengthen the infrastructure first. Then allocation of separate budget. So that I roughly told they are collecting around 1 crore rupees every year from the students. Just tell them that ECLS, you are getting a benefit because we are charging around 5,000 rupees. And after giving to JeevaRaksha, Rajiv Gandhi University also, we can have a save around 10 to 20,000 per program. So if yours is having a 150 students, you can have a 6 program, and even PGs will be there, and you can have a third year. And now NMC has made from the first year onwards only, everybody has to come through skill lab, and the particular sessions are there, particular hours are there in CBME, so they have to use it. So the allocation of separate budget is not a big thing. You can sit with them and discuss. Make the learning resources available so that everywhere you can have a protocol so that they can use it. And even the on of the method of using the skill, the mannequins also can be pasted and you can use it. SOPs, appointment of full-time faculty. This is very important because you cannot have run full-time skill lab without appointing the full-time faculty. Full-time faculty, at least 2 to 3. So if he is from a parent department, if he is transferred, so let him have a for 3 months. So after 3 months, another faculty. So if you have 3 to 4 faculty or 2 to 3 faculty on a rotation, they will be having a full-time faculty. Other people will be there. Provision of support staff in NMC requirement is very important because in initial days, when we started, we only used to open the skill lab and close the skill lab and lift the mannequins. Everything we used to do. So the same thing cannot be continued for a longer time. So we need a support staff, which already I have told in human resources, mandatory to undergo skill lab training for every faculty. So let them see what is the skill lab, what is understand. Even everybody will be having some deficiencies or something so that he can come and learn whatever the thing it is there in the things. Then the networking of activities by regional and nodal centers. So the nearby. So if your students are not able to finish in your batch, you can go to the nearby nodal center or nearby medical college where you can have a training. And when these people are not having, you can have the things, that networking, so that all the students and all the staff will be covered. Somebody will be not able to finish part 2 in our college. So they can go to nearby nodal center and finish it and this. Establishment of the skill lab center for guidance, that we have told. Sharing with the institution, having adequate facilities, teachers training, regular program planning, any other. So with this, so keeping in NMC, keeping in JeevaRaksha, we can have these all the proper guidelines, and we can have around 40 to 50 lakhs spending on the mannequins, and human resources is a must, and some limitations, and see to it that full-time faculty, support faculty, everything is there, and good computer, and the infrastructure also. We have made a table where all the accessories required for that mannequins are kept in that drawer only, so that it will be easier. There will be a wheel, you can push it, you can go on using it. So like this, you can make. Initially it will be a tough time, then afterwards nothing more is required. All the things will be maintained and they will run. So if you have a full-time faculty, that is very important. So talk to the management and get the things ready. So this much is about establishing this one. Thank you one and all for giving me an opportunity. And even at the question and answer discussion, I'll have a discussion what all the things you people will be having, that I'll be giving it. Over to Ram sir, I think.
Thank you, sir. Thank you so much for an excellent presentation. Can I have Dr. Vijayabhaskar Reddy?
So,
Dr. Kora, a question through the chat box or directly?
Ram, you said that I was a great. Ram, you said that I'm great. That's all I heard. Your voice was sketchy. We couldn't hear you well.
I was requesting you to come with your camera switched on, please. Thank you. And Dr. Haripriya? So in the sort of handover phase from one talk to another, we didn't introduce Dr. Haripriya. She's, although familiar to most of you, she's an anesthetist and an HIV fellow from Rajiv Gandhi University of Health Sciences, came as part of rural posting to do a deputation in JeevaRaksha to support the programs. And ever since starting, she has also taken over the program director of JeevaRaksha now. So thank you for your presentation, Haripriya, and you managed that glitch extremely well. Thank you. So the audience, any specific questions you want to ask?
I have questions too.
So Reena, Neela, Suman, Yogesh, Shweta, Anju, Deepak, Sharon, Pranup, Ganashri, Ruth, Srinidhi, nice to see all of you, and 20 others who I don't know who they are. While we're waiting for questions, I just want to recommend 2 places for you to go and visit. Actually, 3 places. If you are thinking of setting up a skills lab, in our experience, we've seen 3 places, not just with a good skills lab, but also running the programs regularly. One, of course, is Dr. Sriram Kora's S. Nijalinkappa Medical College in Bagalkot. And they've had their skills lab for a while, and they run all sorts of programs there. And as you might have already guessed from the organized way in which Dr. Kora has set up a skills lab and had the adequate staffing, adequate funding, and all the other mitigation measures. So, the suggestions and how to problem solve, I found the most interesting in his slide presentation, because that is something which is definitely going to come. You might have 30% instructors, 40% instructors, but as people get more senior, they'll have lesser time in coming and teaching. So a good lab, Dr. Kora's SNMC, Dr. Lulu was signed in earlier. I don't know whether she's still here. So Dr. Lulu's lab in Father Muller's Medical College, and Nitte University is here. Dr. Gayatri's lab in Nitte University, KS Hegde Hospital and Medical Academy. So these 3 places have got excellent, sort of well-established, well-funded labs with good staffing and other infrastructures. While saying that, if you're on a low budget, relatively limited setting and support from the management, I would like to recommend you to go and visit BMCH, that is Basveshwara Medical College Hospital, Chitradurga. I saw Dr. Ganeshri being here a while ago. I don't know whether she's still here. So there, within a limited footprint next to the medical education unit, they've done an excellent skills lab, which fulfills all the requirements, but maybe not running into crows, and given the support and the size of the organization. So on a low budget, extremely good lab, and the passion and the commitment of the staff, making it punch way above their weight in performing and promoting the JeevaRaksha and other courses. So these are the labs we would recommend. And while we're waiting, is there any specific question to any of the panelists? Otherwise, I will start.
I have a question.
Yes, Dr. Reddy. Srinidhi, I can see you. What will you next?
Fine. One comment first. I think the floor area for JeevaRaksha mentioned is 200 plus 120. 200 is skill, 120 is for the theory. But if it's combined, instead of 320, it can be 300. Just a small correction.
Yeah.
And does the NMC mention anything about, it says what equipment should be there. Does it say anything about staffing? Because that will help the people who are running the show to go to management and say staffing, because normally they're very hesitant to.
Yes, sir. It is there, sir.
That will help.
That is whatever the slides, these are prepared by the gadget.
Yeah. So what is the staffing allowed or recommended by NMC?
Full-time faculty, they are telling 2 to 3.
Oh, nice. So
and
I think we should use that.
Trainers around 15 to 20, and supporting staff, computer, videographer, and daily wages, and mannequin technician. That is what they have mentioned.
Yeah. Okay.
With the numbers of the mannequins and the human resources, they have maintained clearly, sir.
Yeah, we should probably start a fellowship now in mannequin management under RGUHS, because we have so many skill labs. There is an acute shortage, right? Not many people to get some. Okay. And the other question I had is there any specific instructor course that NMC recommends for these skills?
There is no instructor course.
Sorry, Dr. Vijay, were you asking another question? Sorry.
Yeah. Was there any instructor course by NMC? Because they have
No, sir.
specified what equipment, what skills to be taught.
No, sir. NMC has not mentioned any specific instructor course, and they are telling each department should start use their own modules, like CBME course. So each modules, the staff has to go and to show it. According to them, whatever is on the patient, instead of patient, you start using them in using mannequins. Same thing is, instead of animal experiment, do it computer aided lab.
Okay, fine. I have other questions, but I'll allow others to answer question and then.
Yeah.
Sir, to add on, can I just add on, sir, with your permission?
Sure, please.
Yeah, madam.
No instructor course, but they have specified the certifiable skills in each department, sir. That has to be done, and that has to be decided by by conducting the meeting among the department. Which skills has to be done in bedside? Which skills we can use the skill lab? Which skills we can use the simulation? All that they have to decide, and then they have to do, sir. Still, they have the course as such. It is not there, sir.
Okay, good to know.
Thank you, Professor Ganeshri.
Yes, sir.
Dr. Srinidhi, yes, you can come on.
Yes, sir. Good afternoon, all of you, sir. This is maybe a general question. So, to be frank, sir, I'm right now not in Karnataka, so I've moved out of Karnataka. So, I want to know what are the prospects for people who have gone out of Karnataka, and how do I reconnect with the ECLS or JeevaRaksha?
Good question.
Where are you?
Yeah, right now I'm in Bihar, sir.
You're in Bihar. Which place in Bihar?
Bihar, Kishanganj.
Kishanganj. So there are multiple ways actually, because this is a good time to be an outside Karnataka instructor. Care India, which is the Indian version of care.org, which is a large charity working across the globe, were wanting ECLS programs in Madhya Pradesh and Bihar specifically. So we were about to go to Bhopal and start the program, and the third wave hit. So that has been postponed, and they're very strong in Bihar. They wanted to be starting this program and training government doctors in Bihar as well. So that is one way of getting involved. And also governments of Uttar Pradesh, Assam and Goa had requested officially for the programs to be conducted there. And we're also in talks with the University of Gujarat to have some programs happening in Jamnagar in Gujarat. So there are opportunities to go and train in Gujarat as well. So any of you who want to be trainers and wanting to train across the country, please drop an email to team@jeevaraksha.org. We can pick you up and sort of utilize your skills in taking this program forward. Another interest we've had is from Bhutan. They wanted all their healthcare staff to be trained in either ECLS, ENLS or BCLS, depending upon their grade. And they're also asking for particular modules like neonatal emergencies, pediatric emergencies, etc. So a modular version of ECLS with a little bit extra detail. So that opportunity is also on the horizons. And the other three countries who were interested were Nepal, Pakistan, and Bangladesh to start with. So the initial discussions again have happened with these countries, because we're trying to build an emergency medicine collaborative across the subcontinent, because as we all know, this really makes a difference to sort of middle to low income resource countries, and this can change the morbidity mortality picture.
So one more question to be asked is, will these ECLS program schedules be displayed somewhere in your website, so that whenever I'm down there in Karnataka, I can be a part of the training program somewhere? Is there a possibility?
Actually, Srinidhi, Kadachur is missing you, and we are in conversations with them in starting their first TOT programs. They are significantly missing your presence in the institution. So our team now knows that you're available and you're interested. Don't you worry, you will be contacted. There is a learning management system coming out in about 8 weeks' time. So the process has started. We are in the user interface designing mode at the moment. So once that comes on, any instructor or provider who is already signed up will be able to see the calendar. You can search the calendar to get the course calendar, as well as look at 30 days forward, what all courses are happening in all the three particular divisions at the moment, which is ECLS, ENLS, and BCLS. Thank you, sir.
Anybody else?
Hello, sir. I have a question. So, now the programs that we conduct, ECLS or ENLS or even BCLS, it is mostly restricted to a particular college. What if an organization which is not having a medical college wants to conduct some training for their candidates and they want to kind of partner with JeevaRaksha? How do we go about that part?
Vijay, you want to take it?
Yeah, definitely. That is a possibility, especially BCLS, ENLS. We want to go that route because we know that the numbers are huge. So it is possible. We can certify an organization as a training center if they meet the requirements, which are what should I say, documented as to what the requirements are. For example, BCLS, you have to have 5 trainers, all the equipment, should have done 2 trainings under supervision, and then will be signed off. Similarly, for ENLS, we have similar guidelines. For the ECLS, generally the requirements are a little more demanding, so I doubt if anybody else would be capable of doing this, but who knows? Maybe Ram, if you have any thoughts.
So, yeah, thank you, Vijay. So, ECLS, we've had interest from other deemed universities, and the way forward is to sign an MOU with them because maintaining quality is important. And we will have discussions and send a set of our trainers across, train their instructors up, and then go forward. We've got 2 mobile units, one in Bangalore and one in Mysore, which are traveling around the state, helping out with the specific programs that you were asking about, Suman. So they can come to a place and just deliver a training program for 40 people. That's a maximum we can do in either of the 2 ENLS and BCLS courses, or train a bunch of people. And for BCLS, you can be a graduate and be a trainer. The BCLS program is currently available in English and Kannada. We are in the process of translating it into Telugu, Tamil, and Hindi. So as the linguistic options become more available, we can spread to other places as well. And that's the plan.
Okay, sir. Thank you.
Thank you.
If anybody else, any question, comments?
We have a question in comments whether
saw
JeevaRaksha
that.
is planning to conduct more trainings in Europe. Yeah.
Vijay, I'll let you take that.
Well, sure. If there is a demand, why not? We have done it in other countries. So probably, Aji, you can tell us who would be interested. Absolutely.
I wouldn't be able to tell you right now who would be interested, but given the fact that we've just gone through COVID and now restrictions are coming down, I think we would be welcoming such courses, especially which does not involve the needing the mouth-to-mouth
Right.
resuscitation. I think this would be very welcome in Europe, and we will be very looking forward to seeing you here.
Yeah, we should talk about that.
Yeah.
Perfect.
Thank you very much for the presentations. They were all very, very good. Thank you.
Thank you.
Thank you, Ajay.
Any other comments? Questions?
Sir, I
Yes,
wanted to ask you something.
Yes, Dr. Gayatri.
Yeah, Dr. Gayatri from Kshema. Sir, actually, I had given a talk about scopes of Skill Lab. In that Skill Lab technician course, something like 6 weeks training them and then little bit
Yeah, we are talking
if
about
we
it.
do that, all the AOTT and BSc people who do the other courses, they'll get the opportunity to work also. Since NMC has made it compulsory, the short-term courses, which certificate courses for the allied science people, JeevaRaksha can do it, and then it will be easier for us also.
That's an
Dr.
excellent.
Gayatri, thank you. Thank you for bringing it up. We had talked about it. I
Because
forgot it. Thank you.
595 medical colleges, and imagine, sir, in Karnataka itself, we have so many medical colleges. And all other colleges now skill lab is a compulsory. So we can
Super.
use this opportunity to produce some more job opportunities.
Yeah, because we have so many skill labs, people can get posted and we can easily get them trained.
Yes.
I think that's a great, we had talked about it, but
Yeah,
I'm
we
glad
can
you
do the
reminded.
6 weeks course where they're posted, and some technical things we can give for the simulators and other. Otherwise, maintaining the skill lab and things and all that, it is usually it is easy. And we post them for all these ECLS and other programs. So like a logbook we can maintain, and 6 weeks training we can give, and then give them. I've called for the job of assistant skill lab coordinator, and I did not get anybody.
We will take it up with RGUHS. We're meeting on the 19th of this month, so we will put it in the agenda.
We can do it as an value-added course, even from nursing background and other. 30-35 is 1,000 salary they will get, and technicians can get 15 to 20. And other perks will be there, no sir. Incentives whenever we do the program, we pay them. So that will be a good job opportunity.
Thank you for the suggestion.
Yes, thank you.
Thank you. Neela Savadi has put in a comment about updating skills amongst trainers. Yes, so this has been one of the first, Neela. Thank you for bringing that up. To just sort of update to where we are right now at, we will be running a series of updating skills workshops for the trainers, especially given the fact that during COVID, many centers were not training regularly. So that is on the way. Thank you for the suggestion.
Thanks.
Technical team, I don't know who you are. We've got a suggestion asking, we do BLS course for layperson. Can we make it certified? You can. How you make a certified course is by just following, first of all, becoming an instructor in JeevaRaksha. And our BLS program is not just BLS. We have basic life support, which includes CPR and choking. But beyond that, we teach people how to stop major hemorrhage. So if somebody has got an upper or lower limb, so that is arms or legs bleeding, and you know that a significant number of Indians die from such injuries because the bleeding is not tied off. So we teach them how to do that. And we also teach them how to be first responders when somebody has a stroke or a heart attack or a faint, a seizure, burns, fractures, snake bite. So 10 common conditions, including one common infection. So over the last 2 years, it's been COVID. Before that, we had Nipah, Japanese encephalitis, etc. So depending upon the flavor of the season infection, that also was included. You come and join us, become an instructor. We will certify you. And if you have a skills lab setup, we will come inspect and certify your setup as a training center. If not, you can rent the mobile unit, which will come and you can train whoever you want to train in the program, provided they have passed 8 standards. So that's one condition we keep, which is having that enough of a comprehension to take on the responsibility of being a team leader and working in the pre-hospital environment. But that can be done. Please contact us at the email which is given before. So Dr. Lulu is talking about a conversation with the VC 3 years back, and the appetite in RGUHS regarding the skill lab technician course. So we will definitely take it up and get back to the skills lab coordinators group regarding the progress. Thank you, Dr. Lulu.
In addition, we should also do like an add-on.
So we're coming up to 5 minutes past 4 o'clock. We started on time.
Continue, sorry.
Yes, Dr. Vijay, I'm saying last 5 minutes up. So yes,
in addition, we could also have a short, like a 3-month course or something in skill lab management for doctors or something like that. It could be externals, like they could do some theory and maybe a few contact classes. It's just a thought, so we can think over and take it forward.
Thank you, Dr. Vijay. Any other questions, final questions? Otherwise, we'll call the session. Right. So we've had an excellent attendance, given it's the first continuing JeevaRaksha emergency education program. We've had a wide audience all the way from Australia. I've noticed you, Anju, sneaking in at some point, to Netherlands, Aji representing us, and all around Karnataka too. Skills Lab coordinators, Skills Lab directors, level 1, 2, 3 trainers from ECLS, ENLS, BCLS. We've had interested parties sneaking in from Tamil Nadu. I can see Dr. Hakim S, who is a surgeon in he's working in Kumbhakonam. So it is really nice to see such a varied group of individuals, because there is one common thing binding all of us, which is that we all want to make a true positive difference to the grassroots emergency care provision in our country. To that effect, Dr. Sriram Kora, Dr. Vijay Bhaskar Reddy, Dr. Haripriya, thank you so much for coming on a short notice and presenting in the first ever JeevaRaksha Continuing Emergency Education Program. I would like you all to switch on your camera, please, so that we can take a group photo of all of you guys. So, being the first program, it's important that we should capture this. Dr. Mohan, I didn't realize that you were there. Hi, this is Dr. Sharath. Nice to see you. Sumla. Akshay, hi. Gayatri Devi, ma'am. Ruth, where are you? Shailaja, thank you for switching the camera on. I'm waiting for Jyoti. Dr. Bhavya, hi. Ashwin, nice to see you from a different institution. Sharon, nice to meet you. We can't see your face.
Hello, sir.
As long as Dr. Bhatt, hi from Sulia. Sulia is starting the training program very shortly. Nice to see you. Reena, hi. Pioneer in emergency nursing course from Father Mullahs. Pranup, hi. Can see you. Yes, Neela. I'm waiting. Hakim, please look this way. Screenshot is coming. Vijay, you got Deepak. Can you please switch on your camera? And Dr. Gayatri from NITE. All the cameras have gone. What happened there? Did somebody switch off from the master control? I'm really sorry. Can you all switch on your camera again? Thank you, Deepak. Dr. Rekha, hi. Shailaja, Nirmala Prasad, Ashwin, Gayatri Devi, Dr. Bhatt. Okay, I'm going to count 5 to 0. Okay, like the log road. That is 3 to 1. We're going from 5 to 0. At 0, somebody is going to take a screenshot, please, guys. Pranup, you're not on. I'm starting 5. Pranup, Nirmala Prasad, please come on. Dr. Gayatri from NITE. 4, 3, 2, smile. Hold a smile. Thank you. Now we need to get those 8 others who are not here. Why are those 8 others not visible? Can somebody get the 8 others too? Dr. Bhatt is back. Dr. Renuka, Deepak Murthy, Jinsi, can't see you guys. Shweta. Okay, starting to count again. 5, 4, 3, 2, smile and go. Thank you so much. Thank you for attending and see you all very soon. Thank you.
Bye, sir.